Now to COVID. Dire warning tonight across the border in northwest Indiana. Nearly 8,000 new cases of COVID reported in that state since yesterday. That is the most in Indiana since December of last year. CBS 2's Marissa Parra joins us now. Marissa, Indiana's governor just held the first press COVID briefing in months, but no new restrictions despite spiking cases.
Hey, Brad, you're correct. No new restrictions announced today, but he did say that there would be an extension of the state's public health emergency. And as you mentioned, he also offered both warnings and a plea.
In the last breadcrumbs of the holidays, just days before the new year, Governor Eric Holcomb gave his first statewide COVID briefing in over half a year with a plea to Indiana.
The safest, surest, swiftest way to get through this as an individual and as a state and our country is to get vaccinated.
With the entire state now under the two highest COVID advisory levels, Indiana's COVID-19 hospitalizations now mirror the peak they saw during the holidays last year.
Our COVID-19 hospital census is at the highest level in an entire year. The number of people hospitalized with COVID has increased more than 700% since late June.
State's COVID update comes almost 2 weeks after Attorney General Todd Rokita questioned the data the state was putting out.
I don't believe any numbers anymore, and I'm sorry about that.
Really?
But they're politicized.
The governor came swinging in response.
I will say that I was stunned and somewhat blindsided by the Attorney General when he said he didn't trust any information. It's quite serious when you accuse or insinuate anyone of inflating numbers. In my book, that's called fraud.
As ICU capacity dwindles in the state, Indiana's hospital system is, in short, depleted and exhausted.
What we need now as healthcare providers are support from those people that have been elected to lead us. The average number of patients in Indiana hospitals across the state is usually around 10,000. And we're right around 14,000 right now, which is well above what we're used to caring for.
And Professor Michael Pollack, who has been crunching COVID numbers in the state from the start, points out this affects you at home, too.
We have a crisis in our hospitals right now, and regardless of how you feel about COVID, this is a problem that's going to affect everyone. If you have a heart attack, if you fall down and break your arm, if you're in a car accident, there simply isn't ICU beds available for you.
Now, we have seen those long lines to get tested, not just here in Chicago. Well, Indiana is seeing the same things. In fact, the governor said today that they are facing a COVID-19 rapid testing shortage. They said they are looking into other sources and they aren't ruling out federal help. Reporting live from the Street Side studio, Marissa Parra, CBS 2 News.
Marissa, thank you.